Hello everyone, this is Dr. Kim. In this video, we're going to compare the image quality of panoramic radiograph versus periapical radiograph. So here we're looking at a panoramic radiograph of a 9-year-old patient, and as you can tell, the image appears rather grainy, and visualizing the precise details of anatomic features, especially the outlines of the roots, is very difficult. However, it does give you a good overall sense of where the roots are. Overall assessment of the root development is possible with panoramic radiograph. I do want to draw your attention to the anterior maxilla, so let me zoom in just a little bit. So here, I want you to spend a moment and look over the anterior maxilla and see if there's anything that looks unusual to you. So hopefully most of you most of you are reviewing the root anatomy of here. We have lateral incisor number 7 and number 8. I hope you saw that there's another opacity in this area, overlapping with the roots of 8 and extending into the midline. Additionally, this area happens to be also very radiolucent, which makes it even more difficult to determine what it is. And here we have 9 and 10. But this is something that you should be able to catch, even if I didn't give you a clue as to where to look at. When I look at panoramic radiograph, especially of someone with a mixed dentition, it's a good idea to count the whole teeth and overall eruption status. Make sure the teeth are developing and erupting in a sequential manner and bilaterally. So here, that's an area of a concern, as a matter of fact. Let me see if I can zoom in even more. There you go. So some of you may be coming up with different ideas as to what this could be, but try to determine what it is and also the position as well as the orientation of this object. Again, based on what I can tell, it's primarily over the roots of number 8, and it appears relatively horizontally positioned in this radiograph, right? Besides that, we have some radiolucent component which may or may not be part of this here, and we may be seeing the pulpal canal or pulpal chamber of number 8. So there's not a lot of detail that we can get out of this image. Just based on this, if you already know what it is, well, I've kind of already shared with you in the title. But now let's take a look at this area again on periapical radiograph and see how much more detail that we can get out of the image. So there you have it. So here it is, tooth number 8. You can actually see the root outline, the PDL space, all the way along the roots. And we have a mesioden, right? A mesioden between 8 and 9. And importantly, we have somewhat of a horizontal but also like inverted mesioden. It's certainly dilacerated such that the roots are located between the roots of the central incisors, and then it's somewhat inverted, then it becomes like horizontal as a part of this dilaceration. Again, did we see that on panoramic radiograph? Absolutely not. As a matter of fact, mostly what we saw is this relatively round opacity over the roots of number 8, and that was about it. It was hard to determine that there was a dilacerated root portion running down between the two roots, right? And we can actually see the pulpal chamber or the pulpal canal, And even the enamel layer is very visible on this radiograph, whereas before it was really difficult to determine whether there was any enamel component or not. So I want you to appreciate the amount of detail that you can get from periapical radiograph. Not only the, and this detail is sometimes what helps you to come up with a final diagnosis on a radiograph. Now let's go back to our panoramic radiograph one more time and re-examine this area. Let me try to play with the contrast, right? Even then, I'm unable to bring out the dilacerated root portion that runs down something like this. It just looks very much like oval-shaped radiopacity. Only because we've now seen periapical radiograph, you can maybe say that this is the enamel layer. It certainly is a little bit more radiopaque, but without having seen the other radiograph, it would have been much more challenging to say this is enamel. And we are seeing pulpal chamber or the pulpal canal space. I hope this was interesting and hope you're taking something away from this video. And we are going to be taking cone beam CT of this area in the coming days, and once I have that data or the CBCT scan, I'll be sharing that with you so that we can determine whether this Mesioden is located buccal or palatal to the roots of number 8. Again, that is something we cannot get from single periapical radiograph. The way to do that is you now have to take at least 2 radiographs using a slot technique, or having 2 radiographs that are orthogonal to one another. So you can have a periapical radiograph, then you can have like a occlusal radiograph, and that will help us to determine the location of Mesioden. Even then, even if that were to be the case, it will never provide as good of an information as you can get from cone beam CT. So when we get that, I'll be happy to share with you. So if you like this video, please smash the like button, and I'll see you in the next video. Thank you.